Good afternoon, everyone. Hopefully you can all hear me and see me. I cannot see myself. I'm still getting very used to this whole Zoom malarkey. So do bear with if there are any issues. But welcome to Module 3. You've made it through DES, and now we are on to Geographic Modelling and Visualisation. So today we're just going to kick off with a nice, gentle introduction to geospatial problems. We'll go through all about what those are, what kind of problems you might want to use the stuff you're going to learn in this module for. And also we're going to get a nice introduction to a tool called QGIS, which is a nice point and click program that hopefully you've all got it installed. Don't panic if you haven't. You'll still get lots out of this session, and there'll be, well, hopefully there will be someone in your group screen sharing and you can still get to know what this program can do. Unlike Dan, I don't have excellent puns for my opening slides. I'm afraid you're going to have to put up with references to musicals and Disney movies throughout. So let's see if I can get to my next slide. Yeah, here we go. So what are geographic modelling problems? That's what we're going to be covering today, as I said, and making maps with QGIS. Next week, we're going to be working through how to get your geographic data into Python. Why are we teaching two methods? Why are we teaching QGIS separately, not going straight into Python? QGIS is a really nice tool. It definitely has its benefits. It's definitely got its niche. People have used QGIS in their HSMA projects, so we're not an exclusively Python course. We are an exclusively FOSS course. So QGIS is a great free and open source tool, and we think it really has a place on the course. But geographic data in Python is also a really good thing to know. We'll go through how to, as I say, get your data into Python, and also into how to turn that into a static map, but also an interactive map. Again, they've both got their places. Interactive maps, you might think that's always going to be the better option, but no, a really good, well-defined static map can tell you so much. Next, we're going to go on to how to calculate travel times. So this is one of the things that I've often found myself has been left out of courses. You're told how to work with travel times, but if you need to get hold of them yourself, how on earth do you do that? So you'll be interacting with a web service to do that, which is another great skill that is very useful to learn. And finally, we'll go into location allocation problems. Now, I'll talk a lot more about what those are in a moment, but effectively it's those kind of questions like, how can I work out where's the best place to put my services? So with that, kicking off with the introduction to geographic problems. The kinds of problems we're looking at in this module are split into geographic and modelling. Where do I place my services? And actually on the prediction side, if my demand continues to grow, is this still going to be the best place to put them? If I close some services, where will the patients go instead? I've got a disease. Whereabouts is it at the moment? Who is, we're all very familiar with those COVID maps showing the prevalence of COVID in different areas of the country, but also over time starting to look at how is that changing over different areas. And finally, where is my demand coming from? And not only this, but actually, is my access then to my services equitable across all the different people who might needing to be accessing these? Can they get to the places they need to in a reasonable time, and so on? So broadly, anything geospatial problem in both health, policing, social care, etc., it's anything that is related to or complicated by geography in some way. So this can be our location allocation problems and our routing and scheduling problems. There are also other just kind of just where is something looking. There is a huge amount of value just in looking at a map outside of these more complex uses of geographic data. So kicking off, location allocation problems. Now, in this map, we've got 5 sites for stroke clinics. Each of these 5 sites don't have enough yearly attendees to be sustainable. So which 2 of these could we close to have the least overall impact across the whole Cornish Peninsula here on travel times? Now, it might look like an obvious answer, but you start playing around with it and maybe it isn't as clear. But it's very valuable to then be able to go through, look at all these different areas, and we'll look at what these different grey boundaries are in a little bit further on, but actually going, right, if I've got car travel times in this case, what's the average travel time for people to each of these services? And we can try it out for every single possible combination of 3 services, so we can work out which ones we should keep going. So actually, it's a case of which of them can I close that will have the least impact on travel times, not just the average travel time, but maybe thinking about these people right at the edge as well. Your average might be quite good, but you could have a few people who are severely impacted. Where should I put my new service? So actually, if we weren't in a scenario where we were getting rid of one of these, if we wanted to add another one, where would be the best place? Would it be this little bit here hidden underneath this label? Would it be up in the corner up here above the Bodmin Centre off to the right? Or actually a little bit further on, we'll start to think, is that demand already covered by this little part of the screen over here with Devon and their services? How many sites do I actually need to have a reasonable travel time, whilst perhaps balancing this with sufficient people accessing each given site? So, you know, it would be great if we could have 10 different sites for people to access here, but that is unlikely to be the most efficient use of resources. But we could start to say, well, I need perhaps everyone to be able to get to this very time critical service within 15 minutes. So in that situation, how many services do I need to place? And finally, is this layout of sites actually sensible or efficient or equitable? It could be that this seems like a great solution with loads of other things taken into account. But maybe there is a pocket of deprivation here. Maybe there's a pocket where people don't have good access to transport, where it would make a lot of sense to have a service up there to make sure that there is this equitable access across different areas. So looking at some real life situations, this is a project, this is all based on a project that was actually done across England by our own Pencord team. So they were actually looking at hyperacute stroke units in England. These are units that aim to provide stroke care that need to be large enough to sustain expertise. So they need to balance having at least 600 admissions a year. And they also need to be far enough, there need to be enough of them and far enough apart to actually make sure that most people can get to them within 30 minutes, that kind of peak key time to make sure that people can be seen and treated effectively. So at the beginning of this, they knew that just over half of people were able to access a stroke care unit that was set up like this, had at least 600 admissions per year. And at that point in time, 90% of these patients were within 30 minutes of the stroke unit. Now, that balance between the expertise and the nearness to the units, that might not be clear cut. So what you have instead is solutions being identified where you can balance these objectives. So actually, if you go between 75 and 85 units, so looking at this x-axis here, and look up to the percentage of patients within 30 minutes of a unit, whilst also having these units having over 600 admissions a year, you find there's a sort of peak point where you are balancing those objectives nicely. And what they found was they could have 82% of patients attending a stroke unit within 30 minutes travel time if you had 75 to 85 units, and all of those would therefore have at least 600 admissions and less than 2,000 admissions. They wouldn't be too big. And actually looking at that as well, you can start to go, well, how many people, if we can't hit this 30-minute target, how many of them will be within 45 minutes? How many of them will be within 60 minutes, and so on? You have all of that data at your fingertips with techniques that we will be talking about in this module. But the thing is, quite often you'll find it's not possible to meet both of your objectives. You might be trying to find a balance between the two. Reconfiguring these units, in this case, you were going to find that you did drop the number of people that were going to be within the ideal distance, but being able to pass that on to your stakeholders to say, okay, this is the best we can do. What do you want to do next is very powerful. Now, the other side of what you can do with geographic modelling is routing and scheduling. So I'm sure a lot of us have sat at home waiting for a parcel, looking at it on a map and seeing where the driver is coming from. And you've probably also seen that they've got perhaps hundreds of parcels to be dropping off in a given day. Now, this is something that computers are really good at solving. It's very important to be able to do this efficiently. It's very difficult to work out exactly the best order to do things in if you are a person, especially at the scale of the deliveries that we now see in the world. So this is a problem that is very frequently being addressed. And it's the kind of problem that can be very valuable within healthcare as well. So take our community nurses who need to be going out, delivering dressings, delivering medication, so on and so forth, care professionals, etc. And you have a lot of conditions around these. You might have people that can only do certain tasks. They might not have been signed off on certain things. You might need certain visits that need multiple people. There might be a particularly difficult problem with traffic for a given period of time due to some kind of roadworks. You might have people that have other specific requirements, like female or male only nurses for particular tasks. So actually, how do you get someone to hold all of that in their head? It's an extremely difficult task, but you've got nurses and admin professionals doing this day in, day out, and it's not easy. And as I say, computers, in contrast, are really quite good at this. So there are tools out there, lots of tools, where people are saving a lot of time by doing allocation on computers. It's often very difficult, as I say, to do this, but instead, once you move that task over to the computer, nurses are spending less time on the road, more time with their patients. You're freeing up time to care rather than do the admin work. And quite often they find that it really helps staff deliver better care. If people go, I could never have worked this out as half as quickly as this computer did, and it has actually made my life and the life of all my staff better. There are examples out there of reducing the team's travel time quite significantly, and what that can equate to for full-time equivalent nurses. And at the same time, you can also start to think about the impact on the environment. So we'll talk a little bit later about some of the HSMA projects, but travel time and calculating carbon emissions is very important, whether that's for patients traveling to your services, your required materials being transported around your different sites, your staff traveling around different sites. This is becoming bigger and bigger all the time, more important, and something that people really want to be looking at. So travel times factor into all of this. And there's a couple of different types of travel time problem as well, routing and scheduling problem particularly. So we have the traveling salesman problem, which is one vehicle trying to find the most efficient route around several points. You have what's called the vehicle routing problem. So this is just scaling it up to multiple vehicles. They need to go to a certain number of visits. You can have it so that they have a limit to how many visits they can do at a time or not. And you also have the dial-a-ride problem, which is picking up a set of customers, perhaps. This might be patients who need transport. There will be a limit to how many people they can fit onto their vehicles. There might be time windows for getting to these people. And there'll also be a maximum amount of time that the vehicle can be on the go continuously, potentially. Now, I've just told you all about these amazing problems, and now I'm going to tell you that the routing and the scheduling we don't cover anymore on HSMA. Now, for the community visit and transport scheduling, it's very often valuable to run this routinely. Once you get into routine problems, you get into problems of uptime and availability and people relying on them. So it needs to be really robust, it needs to be really easy to use. And especially if you're dealing with all of these additional constraints, which aren't easy things to actually code up yourself, it's a problem. However, it's valuable that you know about this, and it is a kind of thing that a lot of standalone software is already good for. It may still come up for you in the future, and it can sometimes be applied to research. So looking at routing and scheduling during the COVID-19 pandemic, the team, the Pencord team again, the team Dan and I are part of, were approached to assess whether patient transport plans for dialysis would be feasible given the infection management processes they were planning to have in place. So here we've got dialysis centres as the yellow stars, and we've got red showing the demand in different areas for dialysis transport. Now here, this is one of these capacitated dial-a-ride problems. You have a certain number of people who you can put onto each vehicle. They need to go to certain places at certain times. They have a certain number of visits that need to happen on given days, and they have a certain amount of vehicle capacity. Now, how do you make that happen when you need to make sure that you aren't mixing patients who could have been exposed to COVID, who might not have been, who are often very vulnerable patients, but you have a finite resource to get to these people? So in this case, they combined a discrete event simulation. So again, you'll see a lot of this with geographic modeling in quite a few of the HSMA projects I'll talk about in a moment. You might do a standalone geographic modeling problem. You might bring discrete event simulation or something else into it as well. But in this case, they were able to look at the modeling and randomizing the infection status of the patients, and then combine this into looking at picking up patients. So here in each green route is, or each green line is a route, each dot is a patient that they are going around to pick up. And you can see that they are, this has just been modeled rather than putting it on a map in this case, it's been modeled, you know, sort of graphically, but it's the same, exactly the same concept. And with this, they could start to say, well, if you have one person on these vehicles at a time, you're going to need huge, impossible numbers of patient transport. But if you start to flex the capacity a little bit, if you start to have 2 people on, 3 people on, 4 people on, you dramatically reduce the number of people, the number of transport vehicles you need. It becomes possible, and it can save a huge amount of drive time. So this was a one-off analysis that needed to happen, but it provided huge value. So there are instances in which routing and scheduling can be used outside of a regular trip type thing. So if you want to know more about this particular problem, I've linked in the slides Dr. Tom Monks, who actually did this work. He did a great talk for us in HSMA 4. So there is a bit more about this particular problem. If this seems like something you might want to do for your project, I seem to be playing it. I don't want to do that. And there is also a little bit of information about this in last year's lectures. As I say, we decided to take it out because we're trying to pack so much in. This wasn't something that we were finding people were picking up for their projects routinely, but it's worth knowing. Dan, do correct me if I'm wrong, but I think we would probably still be happy to support with this approach if people did need to use it in their Inception project. But I think that's, you know, it's just worth knowing it exists.
Yeah, 100%. Yeah. If people are interested, we've got materials there, we've got some expertise within the team. So yeah, please don't let that put you off if you do have a problem like that.
Great, thank you, Dan. So on to a little bit, as I was talking about, some previous HSMA projects, just to start bringing up some ideas for you about how you might want to use this yourself. So really nice project in HSMA 5 or 4. I think it was 5. I'm getting myself mixed up here now. On reducing travel times for treatment for cardiac patients in the southeast of England. So in this case, we had, I think it's Kenton Medway. Yep, Kenton Medway. So you can see down here on this map, you have the boundaries of the county. Now, this little star is a proposed new site, a new hospital site. These 2 stars outside here are where the current hospitals were for this county. Now, this county didn't have any hospital provision for this particular cardiac procedure. So they were looking to put a site in, but where would they want to put it to make sure that it had the most impact? Now, what they looked at was the national median travel time, the national average for this kind of procedure. And what they could do was create maps for their stakeholders to say, if you put the site here, this much of the county will now have a lower than average travel time. This much of the county will still be above the national median average travel time. And, you know, some of it might actually not change status. So you can start to compare the different places you can put this and start to look at the optimal solutions as well and provide that to your stakeholders. So here, they actually turn this into a Streamlit app so that people could sit down and try out different configurations for comparisons. They could try instances with multiple sites being added in. They could compare different configurations all on the same page. And this is the kind of thing as well, after module 7, where we talk about creating these apps, you will absolutely be able to do this sort of thing yourself. Now, another one we had was spatial modelling of violent crime. So these were some of our policing and county council colleagues in HSMA 4, I think this one was. And they were trying to use various crime data variables and spatial analysis and turn this into stuff that could be included in regular reporting. Again, I've linked the video to their talk on their project, and the video is also linked for the one I just spoke about. In this case, they were looking at violent crime data. They used QGIS, so that's the tool we're going to be using today, and they also use a range of Python libraries to explore the data. And this model was able to take a particular crime indicator, identify hotspots and cold spots and outliers, among other things, showing instances where there was more than expected activity compared relative to the area around it, or less than expected, and pass that on to people. They also had statistical outputs from this. So there is a level of confidence to be able to say, yes, this is this seems to be a real trend, not just it's a little bit higher, it's a little bit lower. Again, we're not completely covering hotspots, cold spots, outliers within the main content. We will be doing hopefully a masterclass on this in phase 2. Again, we've just got so much to cover throughout the course, but this is a really interesting area. And again, this is something that you can go away, have a look at their project if that sounds like something that might be of value to you, and then you will be able to look more at this content a bit down the line.
Hi everyone.
I keep playing these. Finally, actually, no, I don't think this is finally, but proposed models of paediatric critical care in the Southwest. So in this case, we had someone who was looking at where to locate some level 2 paediatric care units. There was one in Bristol for the highest intensity care, another one in Bristol, and 7 of the lowest intensity cares across the Southwest outside of Bristol. So should they put their new level 2 unit also in Bristol? Should they put it at the tail end of Cornwall? Where would it be best to put it? So they used existing geographic data, they used discrete event simulations to generate the different stays. So again, when you've got very small numbers of stays, you might find that historic data isn't necessarily that representative of where the new stays are going to come from. You might find that you want to think about the likelihood of people coming from different areas and simulate that over lots of different runs so that you've got some sample data sets for where your demand is going to come from. What this then helped them to do was kind of investigate how many people you might need in the units, how much time people would be spending away from their closest hospital based on the fact that there might not be availability at the time, and how far would it be to get to their home location from their treated hospital on average. Now, this gave them some really nice visual outputs to be able to tell them to be able to tell their stakeholders that there really was a need for a level 2 unit outside of Bristol. This went on to inform commissioning decisions, and it really helped to change things for people by making sure they had a unit closer to home at a really difficult time of their lives. Taking this even further, last year we had someone that used the neonatal care database Badgernet. They had 22 sites, 1,200 possible locations that people were potentially coming from to get care for, again, neonatal, 3 levels of care. And here they took it a step further. We will touch on this in the course, but we don't go into great depth about how you can do this optimization of multiple different objectives. So going, I want to minimize the average travel time, but I do want to have as many people as possible within 30 minutes. But actually, I want to make sure these units don't get too small, but ideally, I don't want them to get too big. And this was just some of the constraints they were looking at. And again, they went on to create a discrete event simulation to explore things like average queue times. This is such a lovely example as well, because Duncan, who did this, he talks about this in the video talk last year. He had done SQL before he started on the HSMA course, but that was the extent of his coding knowledge. So you can be creating incredibly complex things, incredibly complex analyses using the techniques that we will talk about on the course. And at the end of this, they had this really nice dashboard where he'd done it in conjunction with some other people in his organization to actually start looking at different possible solutions and going, right, looking back at historical data, would this meet the activity thresholds? Would we actually have enough people going to this particular configuration of services, and so on? So what I'm going to get you to do now is go away into your peer support groups, and I just want you to discuss some geographic problems that are in your organizations right now. I want you to think about, what does it relate to? What kind of locations might be involved? Who accesses these locations? So what kind of patients, what kind of community group? If there are people accessing locations, what kind of current problem have you got? How would you work out what good looks like in your scenario? And are there any potential what-if scenarios? So for the different kinds of problems you might have at the moment, you might not be able to answer all of these problems. That's okay. These are just to get you started, but thinking about, given what I've talked about, given that by the end of this module, you'll be able to make maps, you'll be able to work out where you should put services, and that there are other kinds of problems as well that we've talked about. What kind of problems might you be able to apply this to? And I know we've got such a wonderfully diverse range of organisations. This is where it would be really good for you to be able to talk to each other, especially across, across policing, across ambulance services, etc. So just to give you a quick example for one hypothetical, So we could have an example where we've got mental health vehicles that need to pick up and transport patients between wards and their home location, or perhaps between different levels of wards. So if they want to move to a ward that's closer to home because a space has become available, or because they need to be stepped up or stepped down in terms of the level of care. Now, in this case, the locations are, as I say, a series of wards, could be potentially homes of patients as well, or it could be other locations like a place of safety where people are taken to for a sort of initial assessment. Who is accessing these locations? So in this case, people requiring inpatient mental health care. So it is a relatively small group. That's maybe the only level you need to go to. It might be a very, very small group of people, or it could actually be, if you're looking at GP surgeries, it could be a very large swathe of the population. What's the problem? Well, it costs a lot to bring in private transport. Would it be more cost effective to bring in an extra vehicle? If you have this extra vehicle, where should you put it? How would you work out what's good? Well, here we might look at the historical data in the different candidate locations, and we might look at how many transport requests this new vehicle might be able to deal with compared to the old one. We might look at how many miles are travelled, how many driving hours are required, the emissions, and how many times a vehicle wouldn't have been available or wouldn't have been able to get there in time if we had this particular configuration. Then we can start asking, what if we had multiple vehicles? Could we move the existing vehicles if we already have some available? What time do these vehicles need to be available? Or do they need to be 24 hours? What kind of thing does that mean for our shift patterns and our costs? If we had fewer vehicles that were smaller or bigger, can we have them transporting fewer people at once, more people at once? So there's a huge range of what if questions you could start to ask. So going to send you away into your groups. What I would recommend is using the Zoom whiteboard feature. You should be able to create a Zoom whiteboard in your group, and then everyone can individually start adding things from their organisation, but just have a bit of a chat. Try and write down some brief jottings about these, and we might, if we've got time, ask you to feedback to the group. I'll pick on a couple of groups at random using the wonderful wheel of PSGs, and we will have a look at some of the problems that you have in your organisations. So not too much detail. If there's anything that shouldn't be shared, I can cut bits of this out of the recording if we need to, but ideally, just high-level things that we're able to talk about. So I will stop sharing my screen and I will send you off. Well, I will get you to take yourself off into your groups. And I'm just going to pop these instructions into the class tannoy as well. How do I'm going to open the breakout rooms. There we go. You may now head to your rooms. Hi everyone, I think we've got most people back now, just keeping an eye on the number of participants. Some really good conversations going on. It's really interesting to hear what different problems you've all got in your different organisations, and I hope you found the same. I'm just going to share my screen once I stop getting lots of notifications that I have new whiteboards available to me visible to see and review after this. So let's share. I'm just going to share the wheel of PSGs if I can find it. There we go. So what I'm going to do is we're just going to have a couple of minutes just to hear about some of what you've been discussing in your groups. So I'll spin the wheel. If someone in that group is willing to just let us know about either a couple of examples of what you spoke about, if there's a couple of interesting ones, or if you want to go into a bit more detail on one, whichever is more interesting to you, and just just a very quick overview of what you discussed in your group. So let's see who we are going to have first. Oh, just ticked over into Pokey. Do we have anyone from Pokey who would be willing to just let us know a little bit about some of what you've been talking about?
That would be me. I'm sorry I'm off camera, but there's something wrong with my camera today.
That's no problem.
Okay, so I can share my screen quickly.
Yeah. Just check that you are able to, I believe you can.
Yeah, I can't. I can talk through it now.
I'm just seeing,
I can now. Thank you.
Hopefully now made it. Yeah, you should be able to now.
Yeah.
Yeah, that's
So,
sharing.
so there were a couple of problems that were sort of issues that were raised around this that we could have looked at. So we chose a hospital at home. So this is about routing and scheduling hospital doctors and nurses to visit and treat patients in their homes. And this is around sort of, they're quite sick patients still, that's around sort of emergency care kind of level virtual needs issues. And it was actually implementing this system in place. The location is the hospital where the doctors are based, the community hub where they've got their stocks, and then the patient home whom they visit. And so who accesses these locations, which is doctors and nurses. What is the current problem? Well, currently it's about how to schedule this in the most optimal style. They're doing a manual planning, so often they're very long days. And they want to try and fit this into sort of an 12-hour time frame where they'd be at least visiting 20 patients a day. And so far, it's proving quite challenging to do this within that framework. They currently have funding for 2 advanced care practitioners, but they think that they're likely to need at least 1 more. But again, this is something that needs further looking at and investigating. That's me.
Yeah, that's brilliant. Thank you so much. I think that's a really nice example. I'd be interested to know if anyone wants to put their hands up in the chat if they're in a organisation that has a similar sort of thing going on. I feel like I've heard about these hospitals at home being quite a common thing. But it was really interesting actually it might have been your group that I popped into that were talking about how the community teams are actually quite good at these routing things because they've had a lot of experience with it before. But when we then come to try and work out the feasibility, it's outside of our wheelhouse, or new teams try and do something similar. So actually drawing on the expertise of those community teams, the kind of teams already doing this can be so valuable. Excellent, thank you very much. I will, just to save a bit of time, I won't share my screen to spin the wheel again. So you will just have to trust me that I am fairly choosing a new PSG. So this time we have Paula. So is there anyone from Paula who might be willing to talk through one of their examples?
Yes, there is. If Amaya can put up the notes that we took, I'll happily talk through them.
I'll just share my screen. One second. Where is my words gone? Sorry, it's all disappeared. Here we go.
Okay, thank you. So we talked through a couple of examples, but the first one we really got to was one from my organisation. We were a large, primarily mental health trust covering quite a large portion of sort of Lancashire area, and we got merged with services South Cumbria. Now, South Cumbria can be quite different to sort of Lancashire. It's quite rural, quite dispersed populations. And this created a problem because we were so used to delivering services to sort of quite dense populations, and to suddenly get this where you've got patients really, really spread out and in the sticks was quite challenging. So this is the services are particularly for children and young people with mental health issues, or what we call CAMS services. And the biggest problem we've had is people turning down appointments or people not attending for appointments. And when we did some canvassing of the patients to find out what was going on, primarily it was down to a factor of just distance. Although that was further complicated by the fact that you've got some children that are unable to bring themselves or to get there under their own steam. So they're reliant on their parents, which then you have to take into account their parents might be working. And then you've also got children that might be at the upper end of the age bracket. So they're perfectly capable of getting there themselves, but for whatever reason or another, they decide not to attend the appointment, don't give us any notice, and just don't attend. So we can't reallocate that resource. So the primary problem was just turning down appointments or not turning up because the places and the times just don't work for people. So the problem is sort of to look at minimizing the travel time for as many patients as possible, whilst also increasing the flexibility of the appointments. So some of the what ifs we put in were things like, could we introduce home visits? But then that would introduce another issue in terms of routing, and that might be sort of a giant problem in terms of GIS, and also maybe using some of the solutions we looked at in Python earlier to look at travel times and things like that. Then looking at whether we could put some new centres in these rural areas and where we could actually locate those. Working together with council to improve bus services and looking at where those bus services run and whether that might be a solution. And then things like mobile clinics, so we could actually go out to them or even do home visits. So yeah, that was ours. We did start talking about another one about urology, but we didn't really have time to get into any detail. We just got down some basic ideas of the problem.
Fantastic. No, that's really interesting. Thank you. And just having a quick look at these other ones as well, as you say, urology units, pharmacy-based stuff. It's fantastic just seeing how much variety there is, and also, as you say, the different problems, the very different problems that you find in the rural centres versus the urban centres. You know, totally different kettle of fish, and how important it is to be able to look at those very different sorts of problems through that geographic lens. So
yeah, I mean, my degree's in geography, so I find this kind of stuff quite interesting. People don't always realise that geography is quite a unique subject. It's the only subject that covers every other subject, because you basically draw from every other subject to answer the question. So no, you can get into some really, really interesting sort of subject areas with geography. So yeah.
Absolutely. No, I may be calling on you for, I hope I don't butcher the subject too much.
Oh, no, I'm sure you won't.
Of this module. But no, thank you so much for that. I think we might have time for one more. Let me just spin the wheel again. And who have we got this time? It has stopped on Motorola. Anyone from Motorola available to give us a quick coverage? Do we?
I'll say something. We haven't written anything else other than on the onto the whiteboard, which we've now lost.
Oh yeah, I didn't think about that.
So yeah, there was quite a few, like lots of different stories that were put up on the whiteboard, and there was a lot of discussion about how problems that one person was talking about had already been solved somewhere else in the country. So there's a bit of a sharing over that. I just talked about how an example that I had about, so we need a new breast care unit. We've run out of capacity in Exeter. We also have a hospital in Barnstable. And our CEO was very keen on us building a new breast care unit in Tiverton, because that's halfway between Barnstable and Exeter. And so that would be the really sensible position to put it. But when we did an analysis and we looked at all our referrals and all of their postcodes and the distance to Barnstable, Tiverton or Exeter, actually the location that would be the least total mileages would be Exeter, and actually Tiverton would create a lot more travel. And so, yeah, that nicely put that idea to bed, because we didn't want to build it in Tiverton, but it was good that we were able to use the data to kind of demonstrate that.
That's brilliant to hear. No, I really like that example as well. As you say, just a relatively simple business, data-driven business case, which is one of the things we really want to help all of you to be able to create through your work, through what you learn on the HSMA. It is one of those things, as you say, that can look so clear and obvious on paper until you actually start digging into those travel times. And we'll talk a little bit later about the importance as well of things like weighted travel times. So rather than just looking at, oh, okay, let's average the travel times from all of these possible demand centres, well, that's all well and good. But if 90% of your people are coming from this particular area, then surely that should that should factor in more than the handful of people elsewhere, depending on what you're analysing. So fantastic, thank you very much. I will not put any more of you through the misery of having to share this, but I will have a look through the whiteboards when I have time, and I may well share some of the examples in the chats, because I'm sure there will be lots of parallels and useful things to hear across different groups, and may help you to link up with people who may have similar problems in different organisations. So, right, I will start sharing my screen again if I can get Zoom to stop taking over. I'm a little bit trapped in Zoom. There we go. So we will go through some useful geographical terms and concepts once I start sharing. And then we will have a little bit of a break before we go back into talking through some of the things you might want to keep in mind when you are working on geographical problems, some of the kind of key practical considerations, and then we'll go on to a little bit of QGIS afterwards. But there is a break in sight in about 20 minutes. So things to consider, or useful things to know about when you're working with geographical data. Well, to start with, there's kind of two main kinds of data you will end up working with. You will have point data, as the kind you might see on the left here, and you will have area data, these larger kind of groupings of areas. These can be many different things, anything from a postcode to a county and many things in between that we will talk about a little bit more. But these two kinds of data are generally dealt with a little bit differently to each other, and they are both very important, and you probably end up working with both of them. So point data, like the data we have in the first instance, you will generally be looking at latitude and longitude. Now, latitude, this is where we have these splits across the Earth. We start at the equator and you go all the way up to the north is 90 degrees positive, or all the way south is 90 degrees negative. Longitude is your sort of west to east, effectively. You start at the Greenwich meridian running through London, and you start working east and west. What does this actually mean when you're trying to look at points of data? Well, let's have a look at the University of Exeter, the St. Luke's campus, where Dan and I are effectively based. Here we have a latitude, our top to bottom, which will be positive. And that will be, in this case, 50. We've started at the equator, we've moved forwards, and we're 50 degrees up here. Our longitude, our left to right, will be negative. And this will be, we're just a little bit to the left of the Greenwich meridian, so that will be negative, and it will be -3.5. Now you can get this information from, well, a range of different ways. If you're on Google Maps and you right click, there will be a nice little thing to give you the exact latitude and longitude. More commonly, you might go from perhaps a postcode. There are various services that will allow you to convert from a postcode to the central point of that postcode as latitude and longitude. And there are other ways you might actually end up with a latitude and longitude, depending on the data set you are working with. But it's a very common and standardized way of working out a point on the Earth where something is. Now, it's important to remember that usually when you are working with a coordinate grid, if you cast your minds back to your maths lessons, we tend to go across and then up. So on this coordinate grid, we'd have a coordinate, our x-axis coordinate would be 2, our y coordinate would be 5. Latitude and longitude likes to confuse us by going up first and then dealing with the across. So just remember that the number for your up comes first, and the across comes second, generally when you're working, if you're given a pair of coordinates. So let's have a quick look at a couple of different examples. If we head down here to Brazil, we have two pairs of negative coordinates. So remember, we're below the equator. Lovely long, very exact latitude here, and our longitude in this case will also be negative. Remember, we're to the left of the Greenwich meridian, this line down here. And to be honest, it's easy enough just to remember that your different quadrants like this if you ever need to refer back to it. But don't worry too much about this. It can just be useful if you're looking at a latitude and longitude to work out if it is roughly sensible, or if something's gone very wrong with your data set and you're going to find your points are in completely the wrong part of the globe. Now, coming up a little bit more just to Britain, generally we don't have to worry too much about very large amounts. We are somewhere between 50 and 58 for our latitude, and we will be somewhere around a maximum of about 1.8 degrees for our longitude and around about -5 for our longitude. So things will generally fall within this this area. Now, what you will also find very often with British data is you may have what are called northings and eastings, or eastings and northings, that way round. So I won't go too much into this, but if you've ever been out with a map somewhere on a nice long ramble, you may have come across the Ordnance Survey maps. Now, this splits the country up into a number of squares. Each one of these squares has a reference that is a pair of letters. But actually, when we're working with computers, letters really aren't that great. They're a little bit confusing. So what we will have, I've gone to the best ice cream parlor in the Southwest. If I, well, you can, it's down in Paignton if you're ever down in the area, called Temptations, really good ice cream parlor. So longitude, -3.5, latitude 50. If we were to look at what's called the eastings and northings for our British data, then the eastings value will be this 6-digit number, and the northings, this will be a 5 or 6-digit number. Eastings is just how far across it is. Northings, unsurprisingly, how far up it is. Won't go into too much detail about how you actually convert from these, but effectively you look at a grid reference here. So this square is, it's 3 squares along, it's 0 squares up. So, well, we're in the second square actually with 2 squares along. So you can see it started with a 2. Here we're 0 squares up. So actually we've started effectively with a 0. And to convert, we start looking at smaller and smaller squares. So we go within this square, and then we start thinking roughly how far along is it? Okay, so it's about, it's quite a long way along in this square. So we'd be looking at the 8 here. How far up is it within this square? So it's about 6 up. And then you can see that corresponds to that 6 here in this case. And so you start getting further and further into that, you go another level of detail. So that's how we start getting all of these extra numbers. Don't need to worry about it too much. Again, the computer will do all of the conversions for you, but just be aware that you will sometimes see data in latitude and longitude. You will sometimes see data in eastings and northings. And now, just to be confusing as well, latitude and longitude, as I said, we go up and across. For when we're working with this other method, we do eastings and then northings, so we go across and then up, just to really throw things off. Now, areas. I'd say areas are generally a lot nicer to work with if you're not geographically minded. So, as I said before, we're all probably very familiar with these sorts of maps. We saw lots of them during COVID times, where we have some area boundary and we have some colour scheme that is denoting a value of some kind. In this case, we're looking at the percentage of people testing positive for COVID-19. Now, there are a huge number of different levels of granularity you can get to with your point data. So we can start at postcode area, these ones here. So a postcode area can be covering a couple of 100,000 people. You then move down to the outcode level, which I think I have on here. So actually the outcode, you get down to this sort of first level of granularity. So the EX2 area is here, the EX4 area is over here. You can see that, well, for a start, I couldn't get anyone to give a reliable indicator of how many hundreds of thousands of people this may cover. But the other thing is they cover very different sizes of area. They aren't necessarily related to the number of people in an area in a particularly coherent way. The sector is when we start adding on that extra level of detail. So we have that first number after the first section of our postcode. That will generally cover around about 3,000 properties. Now, you might be wondering, why don't we just use the postcode? That's generally because it's going to be a little bit too identifying. So a lot of our data will be in postcodes. You probably have access to various data at postcode level if you're looking at patient level data, but it's very easy to be that's too exact for a lot of conditions, especially if you're looking at sort of the propensity, especially if you're doing raw counts for any reason, then that would risk identifying people. So postcode, you're unlikely to use at that level of granularity, depending on your situation. One that you might find more useful are output areas, lower layer super output areas, and middle layer super output areas. These are a right mouthful, so what you want to remember is OAs, LSOAs, and MSOAs. LSOAs and MSOAs are probably what you'll use more frequently. The idea of these is that they are standardized geographical units. The area of them might be different, but they should have a roughly similar number of people living in each one. I say roughly similar because there can still be an awful lot of variation, and we'll think a little bit later about how that can impact what we are showing on our maps. But in the lower layer super output areas, you generally get about 1,500 people. Lower end of that could be about 1,000, upper end could be about 3,000. Again, the output areas, you might start to run into similar problems with the postcode areas. They have quite small numbers of people in some instances. But compared to postcodes, where actually sometimes you might be covering only one property in rare cases, the output areas will always be that little bit more standardized. They don't tend to drop below about 100 people. Middle layer super output areas, again, they will tend to have about 7,800 people, but they can vary from 5,000 to 15,000. So still quite a lot of variation. And again, the geographical area covered by them will vary. But the nice thing about these is they tend to come on the internet with data sets that cover things like deprivation. So the indices of deprivation, so how deprived an area is based on quite a variety of data, but you will be able to get that information at a lower layer super output area, at a middle layer super output area. So they can be used in conjunction with data that you hold, and it's easy to aggregate up to LSOAs and MSOAs from data you may already hold. So an LSOA, this is a little bit of the southwest. We've got the Cornwall border starts just over on the left off the screen here. We've got a little bit of, this is basically mostly showing Devon, a little bit at the bottom of Wales, but you can see that the LSOAs are relatively small, but you do have these little clusters of them where they are clustered around centres of denser population, unsurprisingly, if they are covering a fairly standard number of people. The MSOAs, there is a nice, usually these all just have kind of long coded names. They will also have nice named boundaries for the MSOAs, but there is generally a long alphanumeric code that is used to identify each of these areas. Now, the LSOA and MSOA boundaries do tend to match up, so you will have an MSOA that is split up into several LSOAs. So if we look at this one, this red outline here is an MSOA, and within it we've got 1, 2, 3, 4 LSOAs. Now, other common groupings in the UK, we have local authorities, county councils and district councils. Again, you might be able to get data at this level depending on what you're working with, but also bear in mind that it's not at all consistent. For example, this county council for Cornwall, it's the same as the district council for Cornwall. In comparison, you've got Devon County Council with about 5 different district councils within it. So just bear in mind that these aren't particularly consistent. Healthcare regions, I'm sure those of you working in healthcare who've been there for a little while are, you may remember some of these different versions of how healthcare regions have been grouped over the years. I think we're currently still on integrated care systems, so that will be an integrated care board plus an integrated care partnership. Prior to that, we had CCGs, clinical commissioning groups. So you may still find a lot of data that's available at CCG level, but that will not necessarily match up with previous boundaries or current boundaries. Ambulance trusts, again, these can be completely different yet again from the integrated care system. So here we've got Somerset, Devon and Cornwall, and possibly a little bit of Dorset being covered by the South Western Ambulance Group, but actually the boundaries may not be perfect. Police forces, different again, but those have, again, their own boundaries. And it's worth thinking about the sensitivity of all these levels of data. So as I say, patient locations or service user locations, depending on what you're what your area is, this can be too sensitive. A postcode can be too exact. You're more likely to use the postcode sector, the LSOA, or something even less exact than these. And if you do have an exact number of patients even at those higher levels, you may need to consider what you need to be censoring. If you've got, for example, fewer than 5 patients, you may need to censor the exact number of patients or service users within a particular area. Facility locations, on the other hand, these don't tend to be sensitive. You can generally show these exactly on a map without too much difficulty, using the latitude and longitude without running into any problems. So once we have all these data, we can just put it on a map now, right? And every map that exists is kind of like a map is a map, isn't it? So unfortunately, that's not quite the case. So there's a little added layer of complexity here when we want to work with geographic data, whether that's in Python or whether that's in QGIS or another geographic system. You can't flatten a sphere, so the Earth roughly, more or less, without running into a situation where you have some sort of wrinkle. There are a lot of different ways of therefore cutting the Earth up, as it's so to speak, so that you can lie it out flat on a map, on a projection that we can use on a 2D screen. So this is probably the map you're most familiar with. That's the shape of the world, isn't it? I think we've probably all seen that on a wall somewhere. However, I could also show you this, and this is still the world, and this is still completely correct as a representation of the world, so to speak. Now, how can these both be correct? They are different projections of the world. Different ways of solving that problem of going, how do I get from this spherical system to something that I can display on a screen? The one that we are generally most familiar with is called the Mercator projection. And what you find are these land masses further from the equator are massively inflated. Instead, if you have the Gauss-Peters projection, these shapes probably look very wrong to us, but actually the size of them are relatively correct to each other. So which is right? Well, it kind of depends on what you're trying to do. If you show someone the Gauss-Peters projection for the map, they will probably tell you that the UK looks very distorted, and they're a little bit confused why it looks like that. So you may find yourself, the Mercator projection, it gives us the shape of the country that we're all a lot more familiar with. But it really can matter. So in this yellow color here, we have the Mercator projection. In the blue, we have the Gauss-Peters projection. You can see that nothing is in the same space, and actually the relative sizes of different continents, etc., is just completely and utterly different. It's really quite startling if you've never come across this before, just to realize how distorted our perception of different countries can be through the maps that we have always been shown throughout our lives. So let's take, for example, Canada, which looks massive. Pull this on top of South America, and you realize it really isn't quite as big as it looks, especially further up the top. So why am I bothering to give you this brief geography lesson? So map projections try to portray the surface of the Earth on a flat piece of paper, as I say. The coordinate reference system, which you will need to define frequently when you are working with geographic data, it actually tells it how to get from the coordinates to the map, how the relationship between different points that you have, how you put that onto this projected map in the right place effectively. So you don't need to remember lots of details about this, but you just kind of need to know that they exist and why you might need to be specifying them, and why this might occasionally cause your data to end up in completely the wrong place on the Earth. So the government, the UK Geospatial Data Standards, their coordinate reference system recommendations, they would recommend using the British and Irish National Grid, which is why I bothered to tell you about Eastings and Northings. This is something called EPSG 27700 for any data relating to the UK and Northern Ireland. For most of what you're doing, I suspect you're unlikely to work with European and worldwide geographic data, but these are the other common standards you may come across, particularly WGS 84 for worldwide geographic data. It's kind of the standard outside of the UK, effectively. So it's important to just make sure that, be aware of what coordinate reference system could have been used for data, and we will see throughout the next couple of modules why this might be important and how you can specify this and where you need to specify it. So don't worry too much about the specifics, just know that it's something you need to be aware of. Right. Let's take a 10-minute break. We are at, well, let's take a 9-minute break actually. We're at 2:51. Let's come back at 3 and we will go through some of the practical considerations, and we will also talk a little bit about QGIS. So see you in just under 10 minutes. Thank you, Dan. I knew that would happen. Let's kick back off with a little bit of discussion of some of the practical issues that you might run into when you are doing geographical modelling. So, like with a lot of the modelling we've talked about so far, it's really difficult to take absolutely everything into an account. Any analysis you do is generally best used in conjunction with other information, and your analysis will generally provide decision support, because it's extremely difficult to take into account that patients might not like the car parks in a particular city, or that actually you maybe already own a particular building. So whilst it might not be the optimal solution, if it's the second best solution, well, actually, then we'll go with that solution because we already own the building, capital cost is lower, that's great. Especially gets complicated when you start thinking about public transport. Public transport is notoriously difficult to work with from a geographic perspective. It is possible, but taking into account all of that, taking into account things like the fact that car parks close, all of these things. So providing multiple good solutions can really help stakeholders a lot more than just providing the best solution. Really helping them to see the different options available to them, but actually showing here are 5 good solutions rather than, well, this one's perfect, this is the best, this will save everyone the most time. Well, all well and good until you find that no one wants to go there. And I think Dan gave a really nice example in the chat of just this with there were people driving past the door of a hospital to go to one much further away because they like to do their shopping at the same time. So how you can pull that into a computer simulation or a computer analysis project, really quite tricky. So you will always be just part of the wider work. So as I say, you might also find that your solution provides very good average times, but sometimes you might find people in some areas have very long journey times. So this is just worth thinking how you can communicate this with your stakeholders. There's lots of different ways you could go about this, but going back to the very beginning, remember we had that map with us 5 different possible places for stroke clinics, and we wanted to be able to provide the best 3. Well, actually, if we start looking at things like this is the best solution for your average weighted travel time, so weighting it by how many people are in a given location. Actually, in this case, it's also the best if you just take a simple average. So assume that you have the same number of people coming from every single possible area, and also from the maximum travel time perspective. However, if you then start looking a little bit further down your rankings for your different solutions, so that was Bodmin, the CRCH hospital and the WCH hospital. Well, if you mix this up a little bit, you might find that this one is very good from an average weighted travel time. If you'd just taken the simple average, then you would have thought it was terrible. So you really have to think about what are you trying to do? What matters the most, your average travel times, the maximum travel time of anyone. So in this case, some of the later solutions aren't so good from an average weighted travel time perspective or a simple average, but they are better at minimizing the longest length of time that anyone will ever have to travel. So next, is the demand accurate? So when you're working with certain conditions, so where, especially if you're going to the an LSOA or below, you might really want to think about how likely the pattern of demand you're seeing in your historical data is due to chance. So when you've got very low numbers of cases involved and perhaps not a very long period of time that you've got data available for, is this likely to be a pattern that's going to continue, or is it just the fact that only a certain number of people have a stroke per year? And do you need to be looking at a longer period of time? Do you need to be hypothetically adjusting the demand by the population and the demographics? So how, this can be really important to make sure that you're providing good recommendations. So an example of this is an analysis done using some historical data, again, on strokes. So you're looking at the average travel time to each of these centres based on places where there was data, where people had strokes. That seems unlikely to continue for all of eternity. Yes, there may be more people in some of these situations, but we're looking at LSOAs in this particular instance. Roughly, we would expect there to be different, the right number of people. Maybe it's slightly biased by there being more elderly people in certain areas or people with more risk factors for strokes. But you may need to consider, actually, is this true, or do we need to be considering as well the travel time, what the travel time might be if it was likely that there would be a certain amount of demand across the whole county, theoretically. So in this case, we've simulated demand based on some of these different factors. And you might find it makes absolutely no difference. In this case, the best solution was still the best solution, or you might find it makes a massive difference, actually. So the second best solution was suddenly completely not the right solution at all for some of the later, when you took the simulated possible demand into account. Regional borders and edge cases, so it's really important to think where the demand for your services can come from outside of your area, or whether people from your area might be going outside. I know a lot of us work with organisations that are, surrounded by other counties. It can make a huge amount of difference. So this example where I showed you Glenn and his group from HSMA 5, of course, all of their demand was going to outside of their county. So without taking that into account, well, they wouldn't have had a project for a start, but it would, in other situations where they maybe did have one hospital here, it would still be really important to consider what are the hospitals over here, what are the hospitals over here, and so on. I think in this case, they were just so far out, it wasn't relevant, but these ones were extremely important. You might not have data about this yourself as well. It may be really difficult to work out where these people are going. So will other providers give you that data? How can you track all of this? It's something you just need to keep in mind when you're scoping your projects. You may also need to model other things. So these low demand border areas, how much impact do they have on your suggested solution? So if you theoretically, if you did put a new service sort of somewhere right on the border over here, how much impact does that have if you suddenly have loads of people coming from here that decide, well, this is closer, I'm gonna use this one. And actually, can you get a sense of that demand that might be coming from across the border? What could you do here? You might be able to use demographic and population data to estimate this likely demand if you can't get something from the providers over there. And if you can, it's just something worth playing around with. You may also find that a new service may create demand effectively. There might be things you haven't thought of, so it's so important to spend time speaking to your stakeholders and trying to understand this. Example that I have heard of is there was a new cardiac service that was opened based on the number of people that were being sent out of county to a very large cardiac service that was elsewhere in the country. Very quickly, this new service, which had been spun up based on the amount of demand they were seeing, had a 2-year waiting list. Which shouldn't have happened because, well, they based it on how many people needed it, right? What they found when they spoke to the doctors was that people were too sick to make the trip to the large service, so they would never refer. That demand just never existed in the system, even though the demand did exist. As soon as the local service became available, it was actually possible for people to make that trip. The referrals started to flood in. So you just need to make sure you've spoken to all the right people when you're scoping your problem out to think about how likely is that sort of situation to happen in your particular scenario. As I mentioned before as well, raw versus standardized demand. So we looked at the LSOAs, the MSOAs, and the other areas like postcodes. They're quite similar in terms of the number of people living in them, but it's really not exact. So you will always want to consider whether the effect you're seeing is purely because of differences in the size of the area or the number of people in the area. You may want to standardize your data in some way. So that might be looking at the last estimates for how many people lived in this particular LSOA and working out a rate per 1,000 people, or a percentage of people, say you're looking at the COVID demand, the percentage of people who are testing positive based on the number of people we think to live in that region. We will talk a lot more about how to do this in the GeoPandas session. We won't be covering it in the QGIS stuff, but until then, just always make sure you're asking yourself, is this a real effect I'm seeing, or is there actually something that might be taken away if we standardize this by some other factor? Oh. Well, and now we can have a bit of music again. We all like the music. But now we're going to talk about geographic modelling in QGIS. So, time to get back to actually doing, well, fairly shortly. So why are we talking about QGIS? Small-scale problems in health and social care and policing can often be really well supported with simple mapping and simple analysis. They can make a world of difference. You probably already have some very useful data in your organisation. So where are people located? What's the relative rate of people in different areas? You can work out from that. How might this interact with deprivation? How might this interact with existing services? And so on and so forth. If you wanted to start doing this with commercial software, you might be looking at something like ArcGIS. It's a great bit of software. It's, you know, nothing against it, apart from the fact that you're looking at a couple of £1,000s per year for each license. Now, QGIS is able to do a lot of what ArcGIS can do. It's an incredibly powerful bit of software. It's been around for many years at this point. It's free and open source. It's point and click. It's a nice little break from Python. It's got a really good community behind it. It's very strong. It's very established, and there's lots of tutorials. There are lots of plugins, etc. It's really easy to get started with. I hope I'll be able to show that to you today, but there is lots of power and customization once you start going further into it, which is really nice. You can create a map very quickly, and then you can go hugely into all of its different capabilities far beyond what we'll be able to teach you in the short amount of time we have to go through it. And as I say, lots of add-ons to extend its capabilities. It can even work with Python. So it really can be a tool that you can go away and use. So we had Lindsay from HSMA 5 who told us that she used QGIS to create population density LSOA level maps for a recent project, included all the local building assets, so their GP practices, their schools, their hospitals, their community halls. It was part of a feasibility study for integrated health and social care hubs, and the maps really helped all of the stakeholders to understand where might be a good place to go forward and investigate further. They were really well received by the local teams, and they were used in bids and documentation. So this is a real tool. It's just because it's not code doesn't mean it's not important. So QGIS looks a little bit overwhelming at first, but it is as I say, a point and click program. It looks a little bit like this, and in this case, this is one of the data sets you will be working with, and it is the location of lots of different car accidents. So you can use it for this kind of point level data, but it can also make what we call choropleths, these maps with that are using a scale to show some sort of measure at an area level. And QGIS can actually make some really fancy looking maps. So this is, again, well beyond what we'll be able to teach you in the course, but there are some really nice examples of maps that people have made entirely within QGIS. And this can be, you know, all sorts of things. You know, it's a very flexible and powerful tool. There is a link here that I'll also share in the chat a little bit later that gives you loads more examples of maps people have made in QGIS. Now, within the community, as I say, it's a volunteer-driven project. It's FOSS, but there is this big community here. They even get together and actually, you know, spend time working on QGIS in person. So it's not just a little hobby project. I'll skip past that one. We did start making another book to go with this, but there is not much in there at the moment, I am afraid. So let's make the first map. I'm going to demonstrate just a couple of features of the maps. I'm going to show this entirely within the slides. There's lots of screenshots here. I'd recommend referring back to them. You are welcome to follow along click by click in this section if you want to, but what I recommend is if you get stuck, I'm not going to be able to unstick at this point in time. So if you get stuck, just stop and watch. Also, if you would rather just watch at this point and then actually when we get to the PSG exercise, then you can open up QGIS. Entirely up to you, whichever makes more sense for you. But if you want to open QGIS at this point and have a bit of a click around, then you can do so. If you have downloaded the GitHub repository, the data set that I will be using in this section is under, I think it's : datasets and : So going to be working with two different data sets in this particular example. There's one called headquarters and there's one called stop and search effectively. So yeah, they're in data sets code along. Like I say, completely optional. Don't feel you have to follow along at this point. I know people are often struggling to work across multiple screens. So just watch if you would rather watch. But if you are opening it, QGIS should just be somewhere in your desktop menu bar or start menu. Doesn't matter if it's not the exact version. Hopefully, as long as it's something above version 3, which has been out since about 2018 at this point, then you'll be absolutely fine. And even if it's before that, it might just look a little bit different. So QGIS, when we start it up, we will be presented with something like this. You will probably not have anything in your recent projects section, but by and large, we have this browser, which gives you access to, well, primarily we'll just be using this little thing called XYZ tiles. The layers, we will be using this section a lot, and the layer styling tool panel, which may not be available to you yet. So the first thing we're going to do is make sure that you do have the very crucial panels available so that you can get to what you need to get to. So what you'll do is you'll go into view, you'll make sure that browser, layer styling and layers are all ticked. Those are the three crucial ones. Layer styling we use almost non-stop throughout the rest of the exercise, and it's not there by default. And layers are also important because the layers, we have a layer for our base map, the map that we will, that basically shows you where everything else is in relation to it. We'll have layers for our point data, we'll have layers for our area data and so on. Each one is a separate layer that we can toggle on and off and so forth. So as I say, what you should find at that point doesn't matter if they're not exactly laid out like this, but you will have a browser, which is where we'll get our base map from. We'll have our layers tab and we will have this layer styling one, which until we have some layers won't show us anything. What you will also need to do is go into project and new. So that is how you can get to a brand new clean project for QGIS. Once you are into QGIS, just worth noting that if you're, you can move around the map, which won't exist yet, by using the pan tool. That's what will be selected by default. So when you click and pull, it will move you around on the screen. You can also use the zoom buttons up at the top menu here to zoom in and out. If you're using a mouse with a scroll wheel, then you can absolutely use that instead of the zoom buttons. It's a lot quicker, a lot more intuitive. If you're on a laptop trackpad, you can probably pinch in and out on your trackpad to be able to zoom in and out as well. You might find that a little bit quicker than clicking between these zoom buttons and this move button. So as I say, project new will get you into the base state we need to be in. And QGIS has a rather nice base map built in. So when I'm talking about base map, you'll see what I mean a bit more in a minute, but it's basically the underlying map that shows us, kind of think about Google Maps, you know, the map, the outline of the country, the roads, points of interest, all of that. So what you're going to do is you're going to look in the browser panel, and it'll be on the left-hand side of your screen, most likely. You'll click on the arrow next to XYZ tiles, or you can just double click on XYZ tiles. And what you want is OpenStreetMap. So you can double click on that. And what you should then have is a nice zoomed out map of the world. Mercator projection, you may recognize at this point. So what you can do is zoom in and out. So if you are following along, take a moment just to try zooming, panning, etc. Move around the map. There is a lot of detail on this OpenStreetMap built in by default. You know, it goes to, quite frankly, the level of detail more than you may even ever need. There are some other base maps you can use. So I will share a link with, just in that QGIS book, actually, we do cover how to get the Google Maps base map. You just have to be careful to make sure that you do credit them appropriately, but it is available if that makes more sense for your particular example. And sometimes you may also just want a really plain map as your background. So you want to let your data shine, you don't, or you want to avoid licensing issues, or you don't have access to the internet. And this is also possible. The QGIS book, again, that will cover a way to set this up. We won't go through it here because, to be honest, 99% of the time, this OpenStreetMap, this way that this one that we get through the XYZ tiles, that will be what you want. It's not so great, this one as well. When you zoom in, it's a little bit jagged around the edges, so it's not ideal, but it is a good one in a pinch. So what we're going to do at that point is add in our first point data. So you're probably all feeling quite familiar with CSV files now. So we covered that back in the Python section. CSV is just comma separated values file. It has columns of data in text format separated by commas even. So in this particular example, let's say we've got the headquarters of some police and fire stations. So that will be our first column. After a comma, we will have the latitude for these. You can see it's not too many decimal places in this case, but it's accurate enough for what we need. The longitude, and whether in this case it's a fire and rescue site or whether it's just a police station. So if we loaded it into a program like Excel, it would look something like this, but we can also load it into QGIS. Python is great because it doesn't require it's interoperable. You can pass it over to Linux, you can pass it back to Windows, it will just work wherever you send it. So that means that you have to go through this slightly unintuitive route to pull it in. Our file is a text file. That's what we're trying to import, even though it's points of data. So we need to go into the layer. We go to add layer. So layer up here on the menu at the very top, add layer, and we are adding a delimited text layer. What we'll then be presented with is this data source manager. You can see down the right, it's already chosen delimited text. We can choose all sorts of different ways to import data from, but for now, we're just going to work with CSV files. When you click on the three dots, it will open up a file browser. So you can navigate to the saved headquarters file. So this is just at the very top where it says file name, all the way over to the right, three little dots there. Opens up this file name. And in this case, it won't be that exact path because the session names changed very slightly since I took this screenshot, but navigate to where you've got the headquarters file if you are following along. It's, like I say, it's within data sets, it's within code long, and it's called headquarters.csv. Automatically, it'll only show the kinds of things that you can actually load in. You'll double click on the file or single click and then click open. And now we need to tell it what columns to use to determine the location of each point. So it'll load in our data and it will show us a nice little sample of it so we can see that it's come in correctly. You will need to click on geometry definition to open up some additional options. And when you're in this, you can see that it's recognized we want some point coordinates. And it will probably, if you've got a longitude and latitude column in your data set, it will probably automatically recognize that that's probably what you want to use for your point coordinates. If it hasn't, you'll just need to click into this X field and this Y field to choose from the dropdown. Now, our friend, the coordinate reference system, this is where it comes in and this is where it's important. In this particular case, we are going to choose EPSG 4326, WGS 84 from the list. So when we go here, you see we've got underneath where we chose our X and Y field, we've got the geometry CRS, we've got the project CRS. Now, it might not show up for you. This is okay. If it doesn't appear in the menu, where we've got geometry CRS, you go all the way to the right and there's this little globe icon. You can click onto that and then you will be presented with a coordinate reference system selector. You choose or you type into this filter box 4326. And remember, WGS 84 is this sort of worldwide one. It's this sort of standard one that, everything, if in doubt, WGS 84 is kind of what I'd go with. So how did I know which one to choose though? It's what matters is what was used in the data originally, effectively. You're not worried about what the project CRS is in QGIS. So this is important. You have a project CRS and you have data CRS. When we set up our map, our base map, QGIS basically went, oh, okay, I'm gonna work out what I'm gonna choose a CRS for you, a default CRS. When you then import data, it goes, right, I know what this was set up as, and I will turn it into the correct CRS for the next step. So don't necessarily choose the one that if you look at the very bottom right of your screen right now, you'll see something that says Project CRS. Don't necessarily choose that one. Start off by choosing WGS 84. And then if that doesn't work, try some of these other ones, 3857, 32630. The data sets you're working with today, and most of the time, to be honest, the data sets I think you're working with, you will end up using 4326. It will usually be very obvious if it's wrong, because your data will just end up in completely the wrong place. What I mean by this is when I selected this data set and imported it here using WGS 84, you can see that the data is for some Southwest headquarters. Then it will be in the, they will show up here. If you go at the very bottom, if you used a 3857 here, then it will go into completely the wrong place. It's knocked it somewhere off the coast of Africa here. So you will be able to see that it's in the wrong place. So once you've selected your CRS, you want to just click Add, and then you can click Close, and hopefully it'll be in the right place. If it's not, we head down to our Layers tab in the bottom left, and we can right-click and choose Remove Layer, and then we can go back, try and go through this whole process again of importing it. So we've gone to our delimited text, we've imported our data set, and we can try a different CRS. Now, I've just seen in the chat, we've got one person here who's got a project and a default CRS of WGS 84. So that's fine, that shouldn't cause a problem. It may be that WGS 84 is the default without having imported the tile set. It may be that it is the default with it when you've imported the tile set. It's a little bit different across different versions, and I've found different people's QGIS have been set up slightly, the defaults seem to be slightly different. But try importing, and I'll be floating around the room. So if we do have problems with this, then I can come and try and unstick things. So where did we get to? Yeah, so what you'll find now at this point, you've got some very small icons, possibly not in the most clear color, but you do have some icons in there. So QGIS will automatically choose some points when you add a new layer. We can then use the layer styling panel to change this, and we can also change another quite a range of icon related settings. So we've got this layer styling panel over here on the right, and you can see if I've got my headquarters selected. So when I'm in the layer panel, if I click somewhere around this headquarters, it will kind of highlight it in gray, show me that that layer is the one that's selected, and then we will be given these range of different layer styling options. Your layer styling panel will probably be too narrow by default, and unfortunately this cuts off some very important buttons, like actually allowing you to select things. So what you will probably need to do is hover over this left edge of the panel. Your cursor will change to a double-headed arrow, and then you can pull it out to the left until it takes about a quarter of the page up, and it will then show all of the buttons below. So then we can start doing things like adjusting the size. So here within the layer styling panel, we've just got a little size option. I've jumped it up to 10 here, and you can just play around and it will update live if this little live update box is ticked, which it will most likely be by default. So you can start to change all these settings. If you click on this little arrow at the very far right of the color bar, you can then get this color picker up. So if you click on the color itself, you'll get a different, more detailed set of color picking options. If you click on the little drop down arrow at the very far right, then you will get this nice little color wheel where you can select from some standard colors, or you can drag around until you find a color that you like. You can also choose a different marker style. So to do this, you will click on the marker here, and then you will scroll down and you will have some favorites that show up. So you can actually scroll through, there'll be dot blue, dot red, effect, drop shadow. There's a couple of standard ones in there. They're not the best, to be honest, but worth knowing that they are there. We can also import a custom marker. So to do this, you can see when we've got our marker here, we have this thing that says marker, and within it, we've got simple marker. You might need to click on this little arrow to expand it out, and then you will get some additional settings. So if you click on simple marker, you get all these additional options, quite a lot in. You need to click on the drop down for symbol layer type. So where it says simple marker here, and you need to choose SVG marker. Now, what an SVG is, it's a special kind of image, unlike a, so when you take a photo on your phone or something, it will tend to be a JPEG. That kind of image can only be blown up so big before you can see all the pixels in it. An SVG image is created in a special way so that you have a, it won't pixelate, basically. You can make it as big or small as you like, and this can be very useful, particularly if you're doing programming and you need things to look good at all different resolutions. So I forgot to put this into the repository until last night, unfortunately, so you won't be able to follow along with this little bit, but there are some great places to get these kind of icons for free, so that you can start to make your maps more intuitive and easier to follow. So I've downloaded this one from a place called Health Icons. I will put the link in the chat later, but this one is a person police officer. You can click on the download SVG button, and then you can use that however you want, because all the copyright has been waived. So what we've got now, we've clicked into this SVG marker. Remember, when we select it from the drop down, there are a huge number of options, lots of presets that we can choose from, like accommodation icons, emergency icons, so you might be able to find what you need within there. If you scroll all the way to the very bottom of this, where it says dynamic SVG parameters, you can then click the 3 dots again. So remember our 3 dots when we opened up our point data. Click on the 3 dots, open up a file browser, and then we can choose our icon from wherever we saved it. So in this case, wherever we've put it. Now we've got these more distinctive icons. It's a slightly convoluted route. Don't worry if it's not working straight away, or if you don't have to do this bit today, you can work up to this, but it does really help to have these more distinctive icons that can make our map easier to interpret. So as I say, the Health Icons website is a great source of these completely free icons that you can use in your projects. And so when you click on an icon, you'll want to choose, as I say, SVG as the download type. Font Awesome is another place to get icons that I've used very frequently for web apps, for maps, etc. You will just want to go to this link. I will share that in the chat afterwards as well, and it just gives you a nice set of icons covering a very wide range of themes, not just healthcare related ones. Again, you can download them as an SVG. Now, selecting this icon in our layer styling panel will allow us to go to the label section. So within this, we can start adding labels to our icons. From this drop-down, you're going to choose single label. Then, once you've selected this, you'll see there's a box that says value. Now, when you click on the drop-down, you'll be given a list of all the column names in your data set, and you can choose which value you want to add in. So in our case, we had a column that said the name of the headquarters, and so that's what we've put in. You probably won't need to click apply, they will probably appear automatically. And then we've got something that looks a little bit like this. We've got a series of locations. So here we can see that we've got the Wiltshire Constabulary, we've got Dorset, we've got Devon and Cornwall. This is great. It's not very visible. It's really quite difficult to see it against all of the existing text that we have already got. And also just worth noting, you could choose a different column here. We chose headquarters, but any of these would be available. And in some data sets, you'll have an awful lot of columns you may want to display. You can also change the size, the font, the color, and the formatting. So actually here, I've made it bold. I've made it a little bit bigger, but you can see it's still not really standing out perhaps as much as we would like. So what we can do is we can then add an outline to our labels, and this will make them a lot easier to read. So if we go back to our label section, you can see that by default, when we opened up our labels, it has selected this little ABC tab. All these tabs across here give you a huge range of different things you can do to your labels. So in this case, if we click on this one, which shows a little outline around our label, then you can click on the tick box for draw text buffer, and you'll instantly get something that looks a little bit like this. So now our labels will stand out a little bit more. You can start changing the size of this. You can change the color of this little background and just play around with what looks good. We can also make our labels a lot more complex. Cover that in the next QGIS session. We can start adding together different bits of text. We can wrap them if they're very long, so that they'll go over multiple lines and so on. Next thing we're going to do is to load in a larger data set if you're following along. Otherwise, this will be the kind of thing that you'll be doing later in the exercise. So again, we just want to go layer, add layer, delimited text layer. It's another CSV. It's got a lot more points in, but the method is exactly the same. In this case, we're using, in the code along, Southwest 5 Forces stop and search. And again, it's the same sort of thing. You make sure that you've gone into your geometry definition. So remember, we will have clicked up here. That will have allowed us to find the CSV file on our computer. We will choose point coordinates within geometry definition. That will probably already be selected, and it will probably automatically recognize the longitude and latitude fields. And again, we're just going to choose WGS 84 4326. If this is what you used last time, it's probably already selected. Remember, you can click on this button here to choose it if it's not already available there. And what this will do is load in a very large number of points. In this case, it shows the location of every stop and search that took place within this period of time in this particular area. Now, we can make these points a little bit more useful by categorizing them. And actually, frankly, there's a lot of different things we could do with this data. We could actually take it out into Python, do some aggregations, do some counts, turn it into the kind of maps we were talking about with the area data. But for now, just to kind of get you used to playing around with point data and what's possible, we're going to treat it as a series of points. So we can categorize these. Depending on the value of the column that you choose, the points will have a different style. So we might choose to categorize the points by gender, by age range, by the object of the search. Those are the things we've got available in this data set, but it will completely depend on what you've loaded in. What you probably want to choose is something with a relatively small number of categories. So if you have something like age with potentially, about 70, 80 different values, then that's not going to look so great. If you've got 5 different categories for age, we'll probably go a little bit better. But we'll also talk a little bit more about how you can deal with that in a second. But something like gender or object of the search, there's maybe there's not a huge number of categories to choose from in those cases. So, I thought I had nope, I thought someone came off their mic there, or came onto the mic. Right, okay, so we are going to, within this categorized section, so remember we've got our layer open, we've loaded it up, we've clicked on it here, down in our layer panel if it isn't already selected. So when we've got layer styling panel open, we can see the name of the layer, SW5 Forces stop and search. It will be the name of whatever file we loaded in. And then you've got, at the moment, this single symbol. What you'll do is click on this drop down and you will choose categorized. So what will come up are these different options: single symbol, categorized, gradient, graduated. Play around with this if you've worked this elsewhere, if you've already worked with this before. See what else you could do with these different settings. Maybe try a heat map out, try a point cluster out, see what those look like. But if you haven't, choose categorized. So we're selecting again now, we've chosen categorized, and then we need to choose the value from the drop down. Again, if you're not seeing this button, this little drop down arrow, your layer styling panel might not be wide enough. You'll just need to click and drag it out so it's a bit wider. So we're going to select the column we're interested in from the value drop down. And we're then going to click classify. So this classify button here, and this will look at every single value that we've got in our data set, every single distinct value, and it will now give each of our icons a different color. So now, jump ahead there, you can see that in this case, I've changed from gender to age range. It's now asked me, should the existing classes be deleted or call classification? You do want to click yes. So if you are moving, if you're trying out different values, reclassifying, you want to reclassify because it won't happen automatically, you will need to delete the existing classes. Otherwise, you'll have this odd mixture of gender classes, age classes, whatever other kind of class you're doing. You can untick an entire layer in the layers panel to hide it from view. So if we come down to our left here, you can see that we've unticked our Southwest 5 Forces stop and search. It's hidden now. We can also duplicate our layers and rename them by right clicking. But we can also filter by using these categorized points. So this gives a really nice, easy way to filter our data set by, again, unticking. So over in our layer styling panel, I've now just reduced it to just the people who are over 34 by unticking the boxes next to the other categories. So this can be a really helpful way of quickly exploring your different categories without going through kind of long filter statements that we'll talk about in a second. You might want to look at what your data contains to actually work out as well what else it might be helpful to filter by, what it might be helpful to categorize by. So in your data set, in your layer panel again, you can right click and choose Open Attribute Table, and that will bring up just this nice little preview of your data set. Now, it's possible to do some filtering of your data set within this, but I would say it's not the easiest and nicest way. Instead, I'd recommend you right click and choose Filter on your data set, and this will bring up a query builder. So you can start to build up something like saying, I only want you know, a latitude less than 3.5 or something like that, or an age range where maybe not age range actually, but let's say gender equal to male, something like that. And you can start to string these together, or you can say I only want them from a particular police force, all that sort of thing. So to see what values exist in the column, you're going to click on the column, the outcome, and you're going to choose, you're going to see all the different possible values over here. You can then build your filter clause. So you're going to double click on the column. So over here, I've double clicked on outcome in the fields. I've then chosen my operator. So here I'm going to say I want only instances where nothing was found and no further action was taken. So if I'd scroll down here, I'd be able to double click on that in my list, or I could double click on articles for use in criminal damage, article for use in theft, and so on. It will start building it up in this query builder down for us. If you click test at this point, it will tell you how many rows remain in your data set. This can be really useful just to make sure that you haven't completely, you know, set up a filter that doesn't return anything. When you're happy with this, you can click OK and your data set will be filtered. And you can tell that a layer's been filtered because it will have this little filter icon at the end. So to remove the filter, you'll open up the filter options, you'll choose clear and you'll choose OK. Now, nearly there, when you're done with all of this, you will save your file as a QGIS file. So you can go into Project, Save As, and save this wherever you want to. So we're going to go away and we're going to focus primarily on a few key things. I've covered quite a lot of what you can do with point data there, but the main thing is you want to be able to load in a base map and you want to be able to load in a data set. What data set are we going to work with? We're going to have the Stats 19 data set. This is every road traffic accident that resulted in a personal injury and was reported to police within 30 days of the accident. It's generally filled in by the police at the side of the road when the accident happens, or sometimes it's filled in at the station when it's reported. It is publicly available data, excluding some fields which could identify an individual, but it's incredibly detailed. It covers individual collisions, it covers the people that were involved in those collisions, if there were multiple, if there were pedestrians, if there were multiple occupants of the vehicles. So it's a great way to really play around with a very large scale real data set. Each accident ID, so we have an accident index, a reference, and we can see the exact location of where it took place. We can see which police force it related to. We can see the severity of the accident, how many vehicles were involved. So we've got a lot of columns that we might want to play around with for that categorization. What we can also do then is each accident will link to a row per vehicle involved, a table with a row per casualty as well. So we won't be covering that today, but if you do want to play around with this data set yourself, you can start to look at these lots of different areas of trends. If you're an R user, this all came from the Stats 19 package. It's a fantastic R package that allows you to easily download clean versions of these files. That's what I've used to get the data sets that we're using today. And we're just using 1 year of data, but there's, I think, 5, 6 or 7 years of data available to work with. So what I'm going to do, I'm going to give each peer support group 1 police force to focus on. I'm going to post that in the class channel. What I want you to do is I want you to load in a base map. I want you to load in the data set. I will also post the data set in the class tannoy if you're having any difficulty with downloading it from the session, from the GitHub repository. I've noticed there's a few issues coming up with the fact that some of the file paths are quite long. I do apologise for that. That's something I'll take into account next time. But I will share this CSV file. So you want to load in the base map, load in this CSV file. I want you to filter to the police force I've given you in your PSG. I want you to then create one or more layers using this point data. Choose fields you find interesting. Try and categorize things. Try changing icons if you fancy, make them bigger, maybe add some labels, try adding additional filters. And then just at the end of the session, you can save any project files you've created, and we will be carrying on using these maps for an exercise in the session next week. What I'd also say is if you create a map that you're particularly proud of, if you think you found something interesting, post it in your PSG. I would love to see what you're coming up with. But that's all we're focusing on today, just getting point data in there, manipulating it to make it look a little bit better and making sure that you're able to filter down to data that is of interest. So I will stop sharing. I will send you off, open up the breakout rooms, and I will pop in the class tannoy those what you need to be filtering by. But first, go away, make sure that you've got your QGIS set up, that you can see what you need to be able to see, that you can load in a base map, and that you can load in that stats 90 data set. And by that point, I'll have the police force of interest available for you to filter down by. So, Dan, any questions before I kick off there? I don't think I can see any.
No, I think so. Most of them, there were a couple of things that came up. I think most got resolved. I think there was a hanging question. Someone was struggling with a layer, or it wasn't showing up. So please do shout if that's the case. But I think everything else got resolved or answered. And yeah, I think I think a few people had the issue with the path. I've posted a link in reply there as well. If you do run into that problem, that will explain various different ways you can get around it. There's a 255 character limit on file paths in Windows, and obviously it depends on where you have your file, because you may start with a long file path anyway. So yeah, but hopefully everything is. It has been covered, but please shout if not.
Brilliant, thanks, Dan. Yeah, I've just seen a few people saying actually they do seem to be having the same issue with the map, the street map, not loading in or not showing up, even though it's showing up as active in layers. So one person has just posted that actually, yeah, they had a blue screen and had to zoom out until they could see the world. But I will float around and see why that's happening. It could be an issue with something being blocked by your organization, because it does have to go out to the internet to grab that map, that base map. So that may be something that's going on as well. But we will see what we can do about that. And failing that, still try and load in the data set and have a play around. You won't have anything behind it. I will also post in a quick, actually, can I load in QGIS, and I will quickly show you another little possible solution to this. Is my screen showing? I can't remember if I shared the screen or the window.
Yeah, no, it's still, we're following you. It's loading QGIS. Fantastic.
And what we're going to do with this as well, we've got 45 minutes until the end of the day, so we're gonna I'm going to make sure that we just go to the end of the day. I might bring you back just 5 minutes before the end so we can just regroup. So I'm going to go File or Project and New. I don't think I can zoom this in, unfortunately. This everything's obviously quite zoomed out here. So I'll make this a little bit smaller, but hopefully in the middle of the screen you can see I've got my project CRS down here, got my layers panel, got my layers styling panel. I'm going to go into my XYZ tiles, open up my OpenStreetMap. This is what happens for me. So you might find, as someone said, if you're very zoomed in, you might just have a blue screen and you might have to click and zoom out until something else appears. If it's not coming up, as I say, there might be something more going on. What you can do, neat little trick here, if you go into the coordinate box at the bottom, double click or keep clicking until you can delete everything that's in there. And I think you just type in world. There you go. So you just type in world in the coordinate box, and then you will get this very basic base map. So this will give you a backup option if things aren't working quite as expected. So that may help. And someone else has also mentioned, try reordering your layers. So you might find, for example, if I make the OpenStreetMap available now, you can reorder your layers by clicking and dragging them up and down. So I've clicked, I'm moving it around here, and I can put it below world map and vice versa. And you can see that actually if I put this world map at the bottom of my list of layers, then you can't see it anymore. If I move it up, you can see that it's a slight overlay here. If I made it a bit more of an obvious color, you can see that it will appear and disappear depending on its order in the layers. So that's another one just to keep in mind, especially if you're importing your data set and you think you can't see it. Just make sure that your actual points are above your OpenStreetMap or your world map in this list. Cool. Any other questions before I kick you all into your breakout rooms? I don't think so. Oh, we're finding someone's getting a 404 file not found at the dataset address. Interesting. Right. Okay. I will pop that link into the class tannoy for the actual dataset as well. Just not sure. I'm not sure why that's not showing up there. So that link will be there. So, right. Open Sans installation failed. We've had some very interesting error messages. I do love working with a different bit of software. We've finally ironed out 99% of the bugs with Python. Now we're introducing a load of new ones. I will get back to the people who are having issues with accessing these things in your Slack chat. So do keep an eye out, and I'll be messaging you in there if I have any solutions. But until then, please go and have a play with QGIS. Just have some fun with it. See what you can do. And I will see you at 4:25. Hi, everyone. I hope you had some fun playing around with QGIS and seeing what it could do. I saw a lot of you getting onto things like heat maps and playing around with like the rule-based icons. So really good to see some great maps coming out there. So if you have got anything cool that you'd like to share with the group, please do pop them in your PSG rooms on Slack. There's some really cool stuff happening. I'm sure other people would love to see that. So yeah, I think just to quickly wrap up, next week we'll be going on to covering how to do the area data within QGIS. We'll also be covering a little bit about how to share your maps out of QGIS with other people. But then the bulk of the sessions next week will be on Python. So we'll be back into Python. We'll be, doing the same sort of thing, but within Python, and seeing some of the speed ups that Python can add to your workflow. And again, just keep playing with QGIS. It can be so powerful. It's a really, really great tool. I hope you have seen, nice to get a bit of a break from code. And if you are also, if you do want to come along to the session tomorrow, there is a completely optional session on discrete event simulation revision session. I'll be leading that one. It will be very informal, drop in, drop out as you want to, if you can only come along for a little bit, but we'll be kicking off by just going back over all the concepts. I'll do a little bit of live coding, just creating a simple model with plenty of chances to ask questions, and then I'll be putting you into some groups to work on creating another model from scratch. So if you just want more practice of discrete event simulation, then that session is open. I will repost the schedule in the Plaza. But that is everything for today. Also, if you have any QGIS questions, if anything came up that I wasn't able to answer, then do give me a shout. I'm very happy to answer those sorts of questions. And Dan, anything from you?
Just one thing. Thanks, Sammy. That was really good and great. Just to echo Sammy, really great to see such fantastic maps coming out, and lots of people really getting engaged with geographic visualization and QGIS. That was really good to see. I reminded myself earlier that there's as Sammy said, tomorrow we've got the revision session for module 2, the discrete event. Next Wednesday, so the day after Sammy's next geographic modelling, we've got our first project development clinic. So this is just to explain how these work. These are completely optional. I think it's 10 till 11. Basically, the idea is that Sammy and I will be on the call for an hour, and if you want to drop in and have a chat with us about any project ideas that you're starting to have, then basically it's just an opportunity for you to drop in. So there's no need to make an appointment or anything like that. Just drop into the call. There may well be other people there at other times who can sort of listen in and chip in as well. But the idea is we'll be running a number of these. It's just to give you a space to drop in and chat to us. So I've got this idea. What do you think about it? And we can give you some advice or feedback as well. So I've just seen in the chat. Can it be recorded? I get. So my instinct would be to avoid it. I guess we could do what we do with the revision sessions, Sammy, where we share it, but not on YouTube. I wouldn't want to put them on YouTube, simply because people may be talking about, they're going to be talking about real world project work, which and there may be sensitive information in that. So, but yeah, if we can, perhaps if we just record them and just share them internally with the group. But yeah, it's basically just to give you a bit of advice on ideas. It may be that it's still early. Don't worry if you don't have project ideas at this stage. That's okay. We've got many months of training left to go yet. But obviously, having now been through the discrete event simulation, and certainly by next Wednesday, you'll have seen a bit more of the geographic modelling. Hopefully, you got a bit of a taster of that already. You may be starting to have ideas about potential project work. And so that's an opportunity for you to do that. And we've got, I think, 6 clinics throughout the training, so there's quite a few opportunities for you to come along and chat with us. So yeah, please just drop into that. Sammy and I will be there. If nobody turns up, Sammy and I will just chat for an hour. That's fine. But yeah, do come along to that if you want to talk to us about any ideas. But otherwise, yeah, I thought a really great day, and hopefully you've enjoyed your first taste of geographic modelling. So yeah, well done, Sammy. Great session.
Thanks, everyone. I really appreciate, and yeah, hopefully you'll all be along next week to back to Python, and we'll see some more great stuff around maps. So have a good week. Maybe see some of you tomorrow for the DES session, and I will record what I can from that. I'm aware that a lot of people have a lot of difficulty getting extra time off or extra time to come to these sorts of things. So I'll record what I can, share what I can, and see you next week.
Thank you.
Thank you.